Fighting Blindness Canada's Viewpoint is a virtual education series that brings you the latest in vision research presented by health experts from across Canada. The webinar you're about to watch is a recording. To learn more about the research we fund and upcoming webinars and events, please visit our website at fightingblindness.ca. This Viewpoint webinar is proudly presented by Bayer and supported by Allergan, Biogen, Janssen and Novartis. We'd also like to thank Accessible Media Inc., our national accessibility partner. Everyone here should download the AMI app, which is a fabulous resource. And you can watch excellent programming, including previous Fighting Blindness Canada events. Thank you for watching. We hope you enjoy this webinar and share your thoughts with us in the comment section below. And today we're joined by Shari Shaw, who is the Manager of Health Information at Fighting Blindness Canada. And we're going to talk a little bit about the FBC Patient Registry. So thank you so much for joining us, Shari. To get started, can you introduce yourself and tell us a little bit about the Patient Registry?
Sure, thank you. So like Morgan said, my name is Shari Shaw. I am the Manager of Health Information at Fighting Blindness Canada. I manage the patient registry and the health information support line that you can call into an email. So when you get an email from Health Info, that's from me. So the patient registry is a national database. It's a secure medical database, and it's set up as a research study. And it was designed to connect people living with inherited retinal diseases, such as retinitis pigmentosa, Stargardt, Usher syndrome, and connect them to clinical trials, to improve patient care, and to drive sight-saving research. So it collects information about the patients anonymously and helps researchers and clinicians learn more about the Canadian landscape of inherited retinal diseases.
Fantastic. So who is eligible to join the registry? Is it just people with those specific conditions you mentioned?
So there's a lot of inherited retinal diseases. So anybody who has been diagnosed by a doctor with an inherited retinal disease. I just listed a few common ones, but there's a number of inherited retinal diseases that you can be diagnosed with, and any of those make you eligible for enrolling in the patient registry.
Okay, so how does someone go ahead and join if they're interested?
So there's a few ways that you can join. You can join through us, through the FBC website. You can also contact us, call us, and we will provide you with the information. But the most important thing is that you get connected with one of our 5 intake sites across the country. So we are the gateway to those intake sites. So we'll help you figure out which one is yours. You don't actually need to visit the intake site to enroll. You can do everything by phone or by mail, and you will learn more about the patient registry. The intake site coordinator will talk you through what the registry means and how it works, and then we'll ask you if you'd like to consent, and you'll have to provide your consent depending on where you are or how you're talking to the coordinator. You'll provide your consent, and then you're in the registry.
And you mentioned 5 sites. So how do people know where those sites are, or which site they should be connected to?
So there's 5 sites across the country, and they are in really spread out, and it's based on your location, your province. So you can contact us and we can help you. You can go onto our website and fill out your information and submit it. And once you submit it, you actually receive an email with all of your contact information for your intake site. So you can just go straight to them. Those are really the 2 ways that unless you're already being seen at one of these clinics, in which case you would be notified by the intake site itself.
That's great. Now, we talk a lot about genetic testing, especially talking about gene therapy today and specific genes being treated. So do people have to have genetic testing done? Do they have to know their mutation to get into the registry?
You do not need to have your genetic testing in order to join the registry. I know that it seems like it's, one and the same because we talk so much about how important genetic testing is, but you really do not need genetic testing to join the registry. The reason why we talk about it so much together is because it's it's helpful if you've had your genetic testing, or if you're interested in your genetic testing, we can help you once you're in the registry. It helps us learn more and be able to connect with you better once you're in the database. So that's usually why we're talking about genetic testing at the same time as we're talking about the patient registry. It's not necessary though, but it is helpful.
For sure. So say someone either does or doesn't have their genetic testing, they get connected through the doctor, they get into the registry. So, but what is the overall purpose of the registry? How does it help patients? And is there anyone else that benefits from this information?
It helps a number of people. So I'll sort of go through. So the reason why it helps patients is because it basically is like putting your hand up and saying, I'm here for a lot of people. Your information is de-identified, so no one's really going to know who you are. But based on your disease information, it helps clinicians and researchers learn more about the landscape across Canada. So, how many people have RPE 65? How many people have GUCY2D? It really helps the researchers understand the landscape. It helps the government, when we are advocating for new treatments, we can say this many people in Canada have this disease, and that's why we need to bring, more clinical trials to Canada. We need to bring more treatments to Canada. It really is just supporting the need for these trials and treatments to come to Canada. So that's why we're trying to learn as much as we can about who is affected in Canada so that we can help them. If you don't put up your hand, if you don't join the registry, we don't necessarily know that you exist.
Absolutely. So when the registry was first started, the idea was that, at that time, there weren't any sort of treatments necessarily for inherited retinal diseases. But now, as, the science is developing and, we have even, something like Luxturna that's coming, approved by Health Canada. So has the patient registry been put into practice yet? Have patients been notified of these clinical trials or new treatments through the registry?
Yeah, I mean, patients are being notified by their doctors because of the patient registry of, trials that are becoming available. They were notified through the patient registry about Luxturna if they were potentially available. So it is starting to, like you said, it's now that we're kind of putting these things into practice. Before, it may not have been so relevant. There wasn't as much emphasis on genetic testing. There wasn't as much emphasis on the registry or, forming a registry because there wasn't as much going on. But now we have this momentum going forward, and we really want to keep that up because we want to see the progress, and we want to be able to bring, I say we, as in Fighting Blindness Canada, we want to be able to bring these treatments and these trials to the patients and directly to the patients. So it has started to work, and I hope that in the future we can do more of that through the patient registry and really get a good picture of what the landscape is in Canada.
Yeah, it's such an exciting time. Luxturna being approved is sort of precedent setting, and hopefully there's going to be more to come in the future for sure. So if people have more questions, they're intrigued by your little pitch today, how can people find out more about the registry?
So if they are interested in the patient registry, I encourage them to either contact me if they have direct questions. So I'm available by phone, by email, and I'm sure that we will send all of that information out. So I won't worry too much about putting, saying the information unless you want me to. You can or I can. But if you know that you're interested, or if you want to, get your intake site information, you can go onto our website, fightingblindness.ca/patient-registry. Or at the top, there's a...
Yeah, I popped that in the chat too. So
okay,
if anyone's interested, it is in the chat, and it will be in your follow-up email as well, but it's there in the chat for you.
Great. And you can fill that out. Now that it doesn't enroll you in the registry. It basically just expresses your interest in the registry so that you can get more information. You can be notified of your contact info for your intake site. So, we as FBC, we actually don't have any connection to the database itself. It's a very secure private database. So we are the facilitators. We help people find their way to the research or to the intake site to get signed up.
That's great. Well, thank you. That was all from my questions, but we have some questions from the audience. I've got some from email, and also I see a couple in the Q&A. So if you do have any questions, feel free to pop them in there for now. But okay, so my first question was from Fran, and Fran asked, I think this is a question that you probably get a lot. She says, how do I find out if I'm already in the patient registry? I think I signed up years ago, but if not, I would love to do so.
Yes, this is a question that I get a lot. So there's two ways. One, if you know which intake site you would have joined with, we have Vancouver, Alberta, Toronto, Montreal, and Nova Scotia. So those are the five. Montreal is new. So if you signed up years and years ago, you probably wouldn't have signed up with Montreal. But if you know where you signed up, you can feel free to contact them. You can contact me. I can provide you with their contact information. I can contact them on your behalf. I won't be provided any of your information, but I can just sort of contact them and then let you know whether they said yes or no. So we can do it either way. There is definitely a way to check that you're in the registry. And it's also a good idea, if you've been in the registry for a really long time and you haven't checked in, it's a good idea to check in, make sure all of your information is up to date. The database is not connected to your personal medical records, so it's only whatever you provide them, unless you are a patient at that site. So it's a really good way to keep your contact information up to date so that they can contact you if there's something available.
Yeah, absolutely. Especially if you joined a long time ago, things change.
Yeah.
And you might have forgotten about it. So that's a great piece of advice for sure. Okay, so we have another question from Rohan. Rohan says, I did the gene test, I'm assuming he means genetic testing, and was told by the lab there was no help for me. And we know that can happen sometimes, that people aren't necessarily getting a result. And so he's saying, can I forward the test to Fighting Blindness Canada to get a second answer?
Okay, so I get that question a lot. I am not a medical professional, so I do not have the skills to be able to read the genetic report and provide any sort of advice. My suggestion would be to send the information, if you are in the registry, would be to send the information to your registry intake site and let them input it in the database. If you're looking for an opinion on someone to read your report, I would refer back to your genetic counselor to talk more about that, because there may be someone else who can read the report. It really depends on who your doctor is and where your genetic counselor is. So unfortunately, I don't have that capability, but if you go back to your genetic counselor, I think that you'll be able to talk to them about it.
Absolutely. Okay, I have another question here from Ron. So Ron said about a month ago, his optometrist and him submitted the information requested by the registry. Should either of them have heard back from the registry, and what sort of communications and updates could they expect from being part of the registry?
It's you're more than welcome to check in to make sure that they got the information, that he's been uploaded in the database. Again, they can contact me if they want me to check for them, or contact the intake site on their behalf. Again, I'm not provided any personal information, so it's okay if they want me to do that. The type of communication that goes back and forth with the patient registry, because it's so secure, it's not like frequent news articles, and it's really specific to information that is relevant to the patient, or very important updates. So I would say if they want to be kept up to date with research news and other vision health news, then probably Fighting Blindness Canada the newsletter that we send out is probably going to be really important for them.
Absolutely. So then I have some questions here in the Q&A. So Miriam is asking, so does the patient registry qualify you for clinical trials in other countries like the United States?
The Canadian Patient Registry is for Canadian trials only at the moment. There is an American registry that is open to international patients. You are welcome to contact them if you're interested. But right now, the Canadian Patient Registry is it's focused on Canadian trials and Canadian researchers, and it's very secure, which means that we're not sharing data cross-border.
Okay. So, and Doris is asking, how many people are currently in the patient registry?
It's I don't know most recently, but I think that whatever number I say is going to seem really sort of random. So I don't know whether, Doris should contact me. Not that I don't want to share it. I just think that it's going to be a relatively abstract for most people because it's hard to understand what that number means. And so I wouldn't want anybody to misinterpret that number. So I will reserve that number for now. But if anybody is interested, feel free to contact me for more information. I think that without the right context, I think that number would be potentially misinterpreted.
Understood. So Tony's asking, he says he doesn't know what his mutation is. Can I pay for a complete genome sequencing and have that retained for future research?
So genetic testing does not necessarily do a complete genome sequencing. So when you meet with a genetic counselor, if you have an inherited retinal disease and you meet with a counselor, they will determine the appropriate panel of genes to be tested. So what this person is talking about is whole genome sequencing, and that I think is only done privately or has to go through a different system. But if they do it privately, it can be quite expensive. And all I will say, I'm happy to have a conversation about private genetic testing offline, because I think it's a bit of a long conversation. But you can get genetic testing. There's just some factors to think about when you're getting private genetic testing, and whole genome sequencing is, I think the most important thing would be someone reading it. You'd have to get someone to interpret that, which would be the most important part.
Yeah, I think that's a big misunderstanding a lot of people have about getting genetic testing as well. It's like when you get that result, that report, it's not like you can just pick it up and look, oh, I have this gene. And like it's complicated medical information that needs to be interpreted by someone who knows, the ins and outs of it. And even then, you may not be getting, a result. And a genetic counselor can talk you through what that means and what the implications of that are and what your next steps can be. So it's really important to be connected, I think, with a genetics counselor. And something I was just going to mention, just because there seems to be a lot of questions about the genetic testing. Do you want to mention, we have a resource, these genetic testing guides, because again, private genetic testing is different. You do have to pay for it. But in Canada, genetic testing is covered. Is that not correct?
Yeah. Genetic testing is covered by each provincial health department. So if you live in Canada and it's appropriate for you to get your genetic testing, then it's covered. The funds are covered by the government. So we developed some guides to help people understand the process of genetic testing, and we also updated the information on our website about genetic testing and what it means. And so you can go to our website. We can add that link or you can contact the Health Information Department to learn more about how to get your genetic testing in Canada in whatever province you happen to be in. And I think you made a really good point that, a genetic test report is one thing, providing a cheek swab or a blood draw is one thing, and you can get that report from, whatever private, company you want. But what's really important is the counseling part. And that's, it's probably the most important part, because that's what's going to tell you, the most information about your diagnosis. So if you are interested in getting private testing, I would make sure that you are also getting that counseling.
Absolutely. So I just have one last, actually there's a couple questions here, and they're both about different diseases. So we mentioned at the beginning that the FBC patient registry is specific to people who have inherited retinal diseases, but there's a couple of people here asking if glaucoma be part of it, or corneal disease. Are there like registries for other diseases? I know we get the same question about age-related macular degeneration a lot too. Is there a registry for those diseases?
There's no national that we are aware of. There's no national registry for people with age-related eye diseases like glaucoma or macular degeneration at the moment. So right now, the patient registry is for people who have inherited retinal diseases. I see that. Oh, that's not for us.
No. I think that is all of the questions that we had for you, Shari. Thank you so much for joining us. And I just want to remind everyone that, oh, sorry, someone in the chat is just saying that the genetic testing is covered by the government, but wait times are very long, and we ended up paying to get the results faster. Yeah, so that's something we do hear a lot. It does take time, like things do in the Canadian healthcare system. Shari, what is the typical wait time? Do we know? Is it different probably by province as well, right?
Yeah, it's different by province. We actually have a range on the provincial guides that we have currently. We do state a range. It really depends on what province you're in. But again, like I will say that yes, you can go and pay for private testing and get faster results. And one thing that I will I would make sure if I was getting private testing is if they provide the counseling afterwards, because sometimes I will get people contacting me saying, I have these results, but I don't know how to read them, and I can't read them. So you actually end up having to go back into the system if you want to get in contact with a counselor. It's a little bit faster, but you do have to go back into the system if you want to get in contact with a genetic counselor that's funded by the government.
Absolutely. And just the last point here, Tony made another comment here in the Q&A, and I think it's an important one, is that he's saying if 4 or 5 years ago in Manitoba, they really only tested for one gene, but his version of RP is pretty unique, and he doesn't expect it yet to have that gene identified. So, and that is another thing as well, that these gene tests are constantly being, updated, and research is constantly being done, adding more genes to those pools. So even if you're not getting a result right away, in a few years, it might be different. Or if you had your genetic testing 10, 15 years ago, it may be worthwhile to explore it again. And that's something to talk to your doctor about for sure.
Yeah, it is funded. There are a lot of genes now that they have discovered that result in inherited retinal disease. I think it's like something like over 300 now. But people still come up with no result about 30 to 40% of the time. So, but that doesn't mean there's still a lot of information that can be learned from that. And repeat genetic testing is appropriate. So you should talk to your doctor about what length of time you need to wait, because that depends on the province as well. So what length of time you need to wait in order to get retested. But it's a legitimate concern, yes, for sure.
right, well, thank you so much, Shari. I think that's all of our questions for today, and we're going to move on. But I do want to just remind you that if you have any questions for Shari about patient registry or your health information, you can reach out to our health info line. I have put the number and the email in the chat. I'll also email them out to you after the webinar, but just to triple threat here, we'll say it's healthinfo@fightingblindness.ca or 1-888-626-2995. So again, and you can reach Shari at either of those contacts.